With a smile on her face, Leonie Charles is now welcoming patients to her new clinic in North Palm Beach thanks to a new law. It allows board certified nurse practitioners to operate independently.
So I'm a board certified family nurse practitioner, which means that in the state of Florida in March 15, the law had passed that nurse practitioners can become independent. So Governor DeSantis signed the bill. And then being a nurse practitioner, that means that we are mastered, prepared, registered nurses and doctorate prepared. So that means that, we went to school and then we learned how to assess, treat, manage patients. We have advanced practice in medicine where we could treat patients and then we can read labs and diagnose. And then as a nurse practitioner, one of our main goal for us is health prevention and disease promotion. So we do a lot of education. We try to prevent our patients from going to the hospital, and then we spend a lot of time with our patients. Another deep breath. And blow it out. Good job. So this is my medical exam room. So in this room here, when the clients come in, we're able to have them come sit at the table. I do a full physical exam for them. I have this machine here. This is the EKG machine. This is where we put the 12 leads, on their chest. And this machine will see what's the electrical rhythm of their heart, to make sure that they have no abnormalities. And this machine can detect if they have atrial fibrillation and to see if they have normal sinus rhythm. Also, I have a machine here that we do, and this machine does a spirometer. This is for patient who has, we could check their lungs to make sure that, if they don't have any respiratory problems, if they have COPD, and this is to test if patients have asthma. So this is my intensive spirometer to check for asthma and COPD. Okay, and usually if somebody has any respiratory problems, they're wheezing and stuff, I would use this machine. But all of my patients that comes in for a full physical exam, all of my new patients, I make sure that they have an EKG done, just to get a baseline to see how their heart is functioning.
While Leonie is operating independently at her new facility, Lovely for Life, the Florida House Bill 607 that was signed into law still requires nurse practitioners to also have a collaborative physician.
I have a doctor that I work with now. She's my collaborative physician, which means that, in the state of Florida, even though you're a nurse practitioner, you have to have a collaborative physician, and they're there for consults. I've been a nurse practitioner for 9 years, so I have different people I could call, but I do have one specific, collaborative physician that I talk to her every single week. We talk almost every day, so she's really there for me if I need the support.
That physician is Dr. Kenya Rivas. She has worked alongside Leonie for 8 years, specializing in geriatric care.
With Leonie, I went to different nursing homes, the nursing home that she was in charge with, and rounded with her, nurse practitioners and saw patients and, spoke with the primary care physicians that were in charge of those, particular residents. How do I feel about Leonie? Leonie is a person that, is always demonstrated good attitude. I've never seen her mad, along these years. She's not only knowledgeable, but she's very caring and very honest. I feel like those, attributes are really key nowadays, and more so with these unprecedented, situations. So she demonstrated to be really responsible, really caring, really knowledgeable. And every time she needed help, she was, to consult me. And at the same time, she was really independent. I saw her making decisions after diagnosing patients. Honest with you, we have a gap of clinicians in the field right now. So we are in need of a lot of, clinicians devoted in the geriatric field. The geriatric field has a huge gap. And so we need people, caring and honest people on that field. It's not easy, though, to say, and it's not easy to find.
Leonie still provides care to seniors through her company, Lovely Home Care, which has a staff of at least 8 certified nursing assistants. But here at Lovely for Life, Leonie brings a new touch to family health care, providing not only preventive care, but improving your outward appearance too.
I have the direct primary care, and then also I provide wellness services where we provide medical weight loss programs. Like I know for COVID-19, a lot of people had gained some COVID-19 weight, so we have some weight loss programs. And then with my weight loss program, I usually start with educating my clients to start with doing a detox, because when you detox yourself, you get all the toxins out of your body, and then you could lose the weight properly and efficiently. And then also I provide IV hydration. So if you're feeling fatigued and you're not feeling well, you can come and get like an immunity boost. This is my medical spa room. So this is where we make sure you come in here. You could have a bad day, but by the time you leave my room, you're gonna feel great and rejuvenated and beautiful. So in this room, we have this machine. This is the hydroderm abrasion. So what does this do is, this machine, based on what skin type you have, because when you come in, I do a skin analysis. And then this has this hydroderm here, which sucks out all of the impurities from your skin. So when you finish, you're gonna be leaving with a glow. It's especially for teenagers. And then we treat a lot of hormonal acne, even adult acne. And then I treat hyperpigmentation for especially skin of color. So one thing with hyperpigmentation, we have to be very careful, when we go to different salons and different med spas, because you have to find somebody who knows about the texture and the different type of skin you have, because some of the facials and stuff can cause you to have post-inflammatory hyperpigmentation, PIH. So I do a lot of treatments for hyperpigmentation. Then the products I use, there's ingredients in there to prevent the hyperpigmentation. This is called my body contouring machine. So this is a body cavitation and laser lipo. What does this do is this helps to burn and suck out the fat. So this is a vacuum, it sucks the fat out of your stomach. So you have to come here at least 2 to 3 times a week to get the most desired effect, of this. So this is a vacuum, so you have to just use it around your stomach. And then we have a gel that we use, the ultrasonic gel. And this will help to lose some weight, some inches around your stomach. We can use this, on your arms. If you have some cellulites on your arms, cellulites on your thighs.
There are several reasons Leonie decided to open this facility during a pandemic, including making care affordable. She learned firsthand that the coverage she thought she had with her insurance didn't cover the care she needed.
So I decided to join that the all copay insurance, and then just to find out that none of my specialists, none of the diagnostic centers that I usually go to, and my primary care doctor doesn't take that insurance. So in 2020, it was a struggle for me to get the health services that I desired. Healthcare is so expensive. I had to pay $1,000, copay just to do a mammogram, and then to start all over again, with a new physician. So that's when I decided, everything clicked. That was on March, and I said, you know what? It says nurse practitioners, the governor signed the bill to be independent. This is the time for me to, to open my practice. This is the time to provide affordable health care to those in need, in the, community, so they don't have to go through what I had to go through.
And there's no secret where Leonie gets her inspiration to care for others. Her faith is evident everywhere you look.
We have different services that we provide in this office. We have the healthcare membership with low monthly membership services. We have weight loss that we provide, IV hydration, facials, and home care. Then I just want to support everybody and make sure everybody gets the affordable care they need and feel rejuvenated inside out.